Here on this channel, we talk about questions like, how do you know if you have fibroids? Let's go into it. By the end of this video, you will know what are fibroids, what symptoms you may have if you do have fibroids, and what testing can be done to confirm that you have fibroids. So let's start by talking about what are fibroids. Now, fibroids is a term that we talk about socially, but this is actually not a medical term that we use. The medical terms that are used for fibroids are myomas or leiomyomas. Now, it's completely okay to say fibroids, and for the duration of this video, I'll refer to them as fibroids as well. Fibroids are usually non-cancerous growths that occur inside of your uterus. I say usually because 1 to 2% of fibroids could be and are cancerous. A majority, though, are not. I like to use our model to help us understand fibroids today. Inside of the uterus, fibroids usually grow and develop inside of the uterus. There are 3 different layers of the uterus. The inside layer is called the endometrial lining. The middle layer, more red here on the diagram, this layer is the intramural or the muscular layer of the uterus. The outer layer is almost like a thin skin covering the entirety of the uterus. Fibroids can develop in all 3 layers. If a fibroid is found on the inside layer by the endometrial lining, this is called a submucosal fibroid. If a fibroid develops in the muscular layer, this is called an intramural fibroid. If a fibroid develops on the skin, the top or the surface of the uterus, this is called subserosal. Now, there is a 4th category of fibroids. This is called a pedunculated fibroid. That just means that the fibroid is hanging off of the uterus by a stalk. Now, I talk about these types of fibroids initially because fibroids can cause symptoms depending on where they're located. For instance, if you have a submucosal fibroid, that's a fibroid that is located on that inside lining of the uterus. If a fibroid is present there, it can cause heavy bleeding. Why? That endometrial lining is where periods or blood comes from. So if there is a fibroid in that area, that fibroid can cause an excessive amount of bleeding. Some people may note that bleeding for them is having a longer period. Periods normally would last 5 days and now it's lasting 7. Periods are normally 7, but now they're 10. That's a period that is now extended. Some people may note that their periods will occur in the same length of time, however, they've gotten so much heavier. In fact, they will change their pads or tampons in under an hour and it's completely soaked through. People may even state that they go through packs and packs of sanitary pads or tampons every single menstrual cycle. That is not normal. In general, people should be able to use the same pad or tampon for 4 to 6 hours and it not be completely soaked through. Some people might also have such heavy bleeding that they create blood clots when they have their menstrual cycles. Now, it is kind of normal to have very small amount of blood clots. However, if your blood clots are the size of a lemon or an orange, this may be a problem. Blood clots develop because the bleeding is so excessive from that endometrial lining that it collects on the inside of the uterus because, let me show you this. This is that inside layer of the uterus. If the bleeding is occurring here so fast, your body is unable to release that blood fast enough through this very tiny canal here called your cervical canal. So that blood collects here, and when blood sits in one area for a very long time, a clot presents. When this happens, the uterus will try to contract and squeeze, really, really hard to push this clot that accumulated on the inside through the cervix and through the vagina. So because of that, you may have excruciating cramping and contractions when you have a menstrual cycle at the point at which your uterus is trying to squeeze out this large blood clot that has formed inside of it. Now, those are symptoms of a submucosal fibroid. As I mentioned earlier, fibroids can be anywhere inside of the uterus. If you're enjoying our conversation today, go ahead and like and subscribe, or if you'd rather comment below, we'd love to hear from you. Now, if you have an intramural fibroid, the symptoms may be a little bit different. You may not have heavy bleeding because that fibroid is not in that endometrial space that bleeding comes from. However, a fibroid in between the muscles of your uterus can cause excruciating pain. That's because whenever the muscles are trying to work together, they should really be intertwined. If there is a mass in between those fibers, those muscle layers are working harder to try to squeeze and to stay connected. Because of that, more squeezing equals more pain, which really equals more contractions. If you have a fibroid that is in the subserosal layer or the outer layer of the uterus, usually those really don't cause much problems. Similarly, if you have a pedunculated fibroid, that fibroid that I mentioned that hangs off the uterus at times, that type of fibroid usually does not cause symptoms. Now, it's important to know that fibroids can come in any amount, in any count, and the amount that you have is not reflective of a problem that you have. In fact, you can have a very tiny fibroid that is the size of like a blueberry, and it can cause you a lot of problems. Other people can have fibroids large enough to be like a grapefruit and have absolutely no symptoms. What is most important is that you see your doctors on a regular basis. We recommend having an annual exam at least once per year. With that, your doctor will do a pelvic exam and actually physically feel your pelvic structures. If there are fibroids, oftentimes we can feel that on your exam. We will feel a mass, feel a growth, feel an irregularity that may be caused by fibroids. Secondly, I'd like for you to know that fibroids can grow so excessively that your uterus, which is normally the size of your fist, can grow to be all the way up to your chest cavity. Yes, you can carry around what seems to be like a 9-month pregnant uterus because of fibroids. And of course, they may add to your weight as well. Now, let's talk about risks associated with fibroids. Know that 2 in 3 females will develop fibroids in their lifetime. That's a lot. Yes, most people will not know that they have fibroids because they're either really small or they're not causing any problems that causes us to dig any deeper. Most fibroids develop between the ages of 30 and 50. Research has shown that fibroids are increased in African Americans, Caribbean, and obese people. Up to 70% of white women and 80% of Black women may have fibroids at some point in their lifetime. So we talked about how fibroids can be found on a pelvic exam. However, the real diagnosis for fibroids really is by ultrasound. Ultrasounds can locate fibroids, identify them, and measure them so that you know how many are there and how big they are. Know that the amount of fibroids that you have or the size does not reflect the symptoms that you have or a problem in your body. Many people can live with fibroids for the rest of their lives and not remove them and not have a problem. Fibroids tend to shrink or stop growing at menopause. On average, menopause occurs at the age of 51. So if you do have fibroids, don't be alarmed if your doctors recommend not doing anything if you're nearing menopause. If you do have symptoms that are affecting you, affecting your lifestyle, and are causing you a lot of pain, then you may want to consider removing fibroids or getting a procedure to shrink them. Other imaging may also give you an idea of whether or not you have fibroids. Sometimes, incidentally, we may note them on a prenatal ultrasound. You may also have a CAT scan that could have been done for another reason, but may identify or let you know that fibroids are present in your uterus. An MRI is another study that can be done to give you more information about fibroids, where they're located, and what size they are. Lastly, there are other imaging tests as well, such as a saline-infused sonography, which is a special type of ultrasound that places water on the inside of your uterus and helps you to identify structures that may be in the endometrial lining. With all of these testing together, we may know whether or not fibroids are present and to what extent. I hope you've enjoyed our episode today and having this conversation about fibroids. Thank you for leaving messages below, and I have a free gift for you. As a gift, if you click on the link in the description area, you'll be able to access a free copy of my ebook, Hormones Don't Lie. With this, we talk about different hormones that are within the female's body, as well as how to balance them and achieve best health. Thank you so much for being here today. I am Dr. Perkins, and it's been a pleasure. See you next time.